Very good morning to you all. Today I am here to discuss new developments in anti VEGF medications. I have no financial disclosures to make. You all know anti VEGF injections which dominated up to 2020 were ranibizumab biosimilars, then bevacizumab biosimilars, vegaptanib macugen, which is now no more in use, then aflibercept, which is marketed as AIOCMTC1. It was FDA approved in 2014. Just for sake for revision purpose, aflibercept is a fusion protein that binds VEGF-A with higher affinity than bevacizumab and ranibizumab, and also binds VEGF-B. Because of its dual domain arm, it provides double VEGF trap, and that is why it is more potent. Now, Ziv Aflibercept is marketed as Jaltrap, has the same therapeutic use as that of Eylea. It is shared injection available in bigger vials like Avastin. It is off-label drug mainly used in colorectal carcinoma, but there are issues related to dose and osmolarity. It is not FDA approved and it is not commonly used in many centers. Now, new developments occurring after 2020, new drug arrivals, brolucizumab, faricimab, conbercept, and new delivery system, port delivery system, pre-filled syringes, 34 gauge needle, etc. Now you all know about the Pagenex. It is a Novartis product, brolucizumab. It is humanized single chain antibody, inhibits all isoforms of VEGF-A. It is the smallest functional unit of an antibody, and among all anti-VEGF, it has the lowest molecular weight and greatest molar dose. So it is more it has more tissue effective tissue penetration, and that is why it reaches choroid very easily. As I've earlier told, it has the smallest molecular weight. The molecular weight of brolucizumab is only 26 kilodalton, whereas bevacizumab is 149 kilodalton, and aflibercept 115 kilodalton. So small molecular weight, high molar dose plus high drug concentration make it more effective. It is 11 times more effective than aflibercept and 22 times more effective than ranibizumab. Now, if you give one shot of aflibercept, its equivalent molar dose is 1, and if you give one shot of brolucizumab, equivalent dose is 11.2. So, brolucizumab is 11 times more potent than brolucizumab. Now, since it is a talk of only 7 minutes, I will be discussing all these studies in very short. HARRIER and HARRIER are two similarly designed phase 3 trials which were comparative study between aflibercept and brolucizumab, comparing their safety and efficacy for treating neovascular AMD at different dose intervals. HARRIER was performed in American continents, then Japan and Australia. HARRIER was performed in Europe, Asia and Southeast Asia. Now, HARRIER study, Dr. Vibhuti, can you come here? Yeah, sure. So, anyhow, CNVM HARRIER study was performed with 3 milligram as well as 6 milligram dose, and in that study CNVM as well as PCV was included, and in this HARRIER study only CNVM was considered. Now, observation of HARRIER and HARRIER in simple words, after loading dose of 3 monthly, that is 4 weekly interval, brolucizumab when given at 12 weekly interval, that is 3 monthly interval, and aflibercept when given at 8 weekly interval, that is 2 monthly intervals, you can say, brolucizumab gave a similar and non-inferior result compared to aflibercept. So, summary of vision related outcome, they considered 2 points, 48 week and 96 weeks. They found that brolucizumab was non-inferior to aflibercept for the mean change in BCVA at 48 weeks, and which was maintained up to 96 weeks also. Then safety concerns with brolucizumab. In both the HARRIER and HARRIER, both studies, they found that brolucizumab was producing intraocular inflammation, which was not there with aflibercept. Now, some Indian studies, Braille study is very important. Debdudal et al. Did a Braille study. It is a 52-week PRN study done in naive or switch therapy Indian patients of neovascular AMD. And this study, in simple words, injections were given on SOS basis, considering the situation of visual acuity and OCT anatomical findings like SRF, intraretinal fluid, central macular thickness, PED, And it suggests that unlike monthly loading dose or 3 monthly maintenance dose as suggested in HARRIER and HAWK, we can give brolucizumab injection as per need on SOS basis, hence reducing the burden of injection, helping much to the Indian poor population. Now, this is the dose duration between first and second, 10.98 week. They suggest that could yeah. Then duration between second and third, 11.71 they suggested. So in this way we can reduce the burden of injection. Now coming to the KESTREL and KITE studies, these were two different studies, and they were the purpose of this study was to compare the efficacy and safety of brolucizumab with aflibercept in patients with diabetic macular edema. Now in KITE study, Indian patients were also observed. The results were that after a loading dose of 5 injection, here they gave a loading dose of 5 injection, in HAWK and HARRIER they gave a loading dose of 3 injection. The patients maintained a stable vision with 12 weekly brolucizumab injection compared to 8 weekly aflibercept injection. This is the elaboration of results of KESTREL and KITE. And then coming to faricimab, it is a bispecific antibody that binds and inhibits both VEGF A and angiopoietin 2. It is not available in India. It was FDA approved in 2022, and certain trials have been done in this case. TANEA and LUCENTA trial was done. It is a comparative study of faricimab with aflibercept for treating neovascular AMD, and they observed that faricimab is non-inferior to aflibercept in terms of BCVA in treating neovascular AMD. Now there is new molecule convercept. It is commonly used in China. It is a heavy molecule, 143 kilodalton, and it is strong drug. It binds all isoforms of VEGF A, B, C, but it has certain issues related to complications. That is why it is yet to be FDA approved, and it is not used outside China. Then abicipar-pegol is a new molecule which is in pipeline. Now new developments in delivery system. Lucentis PDS was launched. It is not available in India. Surgically, it is surgically implanted refillable device, allowing continuous delivery of specially formulated ranibizumab. Here you can see the what happened. Cursor is not moving. Yeah, here you can see the drug is continuously being released in the vitreous cavity, and a study was done, ladder study, which showed that we could refill this refillable device every 6 months. Then this is how it is refilled, and this is the slide. These are the slides showing how it is implanted. Phase 3 trial was perhaps done in Shankar Nethralaya, and these slides are how to implant. These are the slides from Shankar Nethralaya as the people have supplied to me. Now coming to the another depot formulation. Now prefilled syringes, eccentrics have come up with prefilled syringes which is available in India, you all know. And now less traumatizing needles have arrived for intravitreal injections, 32 gauge, 33 gauge, 34 gauge needle. Thanks for your patience.